care be kind of extended out to the home. And many homes don't have technology, they're not, say technology ready. Is there anything in policy or reimbursement that's looking to fill that financial need of the home so that care can be extended for preventative, the electronic scales, letting them know if a CHF patient is gained 3 pounds, is that sort of thing?
Yeah, so it was interesting, and Carrie had a point that's coming up about another issue. Tell me if you need to jump in now or...
Go for it.
Oh, yeah, I'll go for it then. Thank you for that. And then I'll go right back to you. In the past, there was really not a lot of incentive for physicians or hospitals to do a whole lot helping families deal with those kind of issues. But again, as we move toward payment for outcomes, suddenly how well people do outside the hospital is important. And Lisa brought up the point of, like, we may wind up keeping patients longer in order to make sure they don't get readmitted. That's not, ultimately can't happen. It's unsustainable financially. We have to find new ways of doing remote monitoring. And in the past, there was no incentive for physicians to do that, and insurance companies wouldn't pay for it either. But if doctors and hospitals are paid for how well patients do at 30 days, at 6 months, at a year, something that makes sense. And remote monitoring is around. Runners in the audience? Any runners? Big runners? Okay. What do you got? You got a chip? You got a watch? What do you got? You got a chip. Okay. And who's got a watch or a phone app for it? Over there. So you have satellites from space monitoring your exercise remotely, right? We have the ability to do these things. Can you hold the mic for half a second? So. There we go. So I have a little thing on my wrist which monitors my activity, how much I move around, how much I run, how many steps I take, how many calories I burn. And what's important about this is, do you like exercising? No, you don't. No one really, but do you share your runs with your friends on Facebook? No, do you? No. Anyone share their exercise with their friends? There we go. And so it's not that you enjoy exercise, you enjoy the moral superiority over your friends. And what's key about that, if you look at other industries, what they found is that, if you help people set goals they'll like you to start meeting them. If you give them feedback against that and make it automatic, right? So if I can track my running, if I can track my exercise, it makes it easier for me to do that. Interestingly, if you make it social, people are actually 10 times more likely to reach their goals. So it's not that I like exercise. I'm shamed into exercising by this band on my wrist, because if I don't, my friends will know that I'm not exercising. And so when you think about it, we've got these technologies. So if you have a hip replacement or knee replacement, and you get discharged from the hospital, all of a sudden there's an incentive for physicians to slap one of these things on your wrist and say, here's your program. Here are the other people who also got discharged. Let's get together, make sure you know who's doing what. And guess what? If Bob is not exercising, his friends will know it, and guess what? Maybe a nurse will call him up. So suddenly there's incentive to do these kind of things, embrace these kind of technologies that allow us to make this work. I mean, the struggle, of course, is that it relies on devices, it relies on broadband, and it relies on the ability for this communication to happen. And I think there are struggles in that area, if I may ask you about that.
Why, yes, Dr. Greenspan, there are. So I wanted to make 2 points around as we think about moving care towards the home. Technological advances, especially around the ability to miniaturize, these big box technologies that generally exist within a facility, and then make them mobile. For example, at our institute, we have a technology called Sense for Baby, and it's a fetal heart rate monitor. So instead of this giant cardiotocograph that an expectant mother has to go visit in her 3rd trimester, we've got a device that's the size of an iPhone that straps on the belly, can go with a worker into the field to actually provide care, a standard of care that many women may not be getting because they can't actually get to a hospital. And we're doing a research study in Mexico with the Carlos Slim Institute around this. But to address your question around, policy efforts to, how do you make that home ready? What about people who just don't have internet, there's no connectivity, no affordability? The FCC actually has a fund. It's called the Universal Service Fund. If you look on your phone bill, you'll see a USF charge. It's about $7 to $8 billion that is designed to help meet, and they're modernizing this program, but it's about filling the communications gap. So it's focused on broadband, and there is a program about $1.3 billion for low-income individuals. There's a program for schools and libraries. There's a program for rural and hard-to-reach areas. That's about half the fund. And there's a rural healthcare program. So there are some federal investments, but you have to know that they exist and how to find them and how to apply for them. And we all know government applications are very easy and straightforward. And then, more than just that, even if your home has the connectivity, you have to have the understanding of how to make these things work together. The thought of my, 75-year-old father figuring out a wireless weight scale and maybe some blood pressure cuff and a pulse oximeter, he doesn't even text message, right? So, that he's going to go to, maybe Best Buy and, figure this out, so we actually need the resources to get over the education and then help folks not just have the infrastructure in place, but adopt and implement the technologies in a way that they'll be successful. And there have been a lot of private sector initiatives and emphasis on this. All the large payers have their incentives aligned around this, keeping people well and healthy. So large companies, I don't work for a consultancy, so I can name large companies. Things like United Healthcare care a lot about telemedicine and reaching the patient in the home. Aetna, Cigna, all of these places are, working on pilots. There was a pilot actually between a health system in New Jersey and Best Buy saying, we have seniors who we'd like to have these remote monitoring devices in their home. What can we do? And they actually got good clinical and financial outcomes. So there's pockets of activity, but I agree it would be beneficial if there were a more holistic approach. The type of care you get shouldn't depend on where within this country you live and who you know.